Hi everyone, my name is Eran and I'm the founder and CEO of XRHealth. We are running virtual reality and augmented reality clinics, and we are treating patients remotely using this amazing technology. I'm not originally from the healthcare scene. I'm a former F-16 pilot in the Israeli Air Force, and about 8 years ago I was diagnosed as suffering from whiplash injury due to the active flight and the G-forces. Then the idea came about to combine VR and rehab, and that's how we got started. At the same time, my wife got an offer to come and do her postdoc here in Boston, and I knew that no one would hire me here as an F-16 pilot because it's not a relevant profession, so I had no choice but to establish a company. We were the first company to register FDA-grade VR AR applications. We started with physical therapy, but we then expanded to multiple other areas, and we are now treating pain management, neurological disorders, stress and anxiety, and even autism. Patient can just sign up on our website today. One of our clinicians, we are hiring physical therapists, occupational therapists, psychologists, social workers. So one of our clinicians will conduct a video call to make sure that those patients are suitable to use virtual reality. Then we are shipping them a headset pre-installed only with medical software, no gaming, no entertainment. The patient is getting the headset, downloading a mobile app that guides them how to use the VR for the first time, and then they're conducting virtual reality treatment completely remotely, where one of our clinicians can transport the patient to different types of virtual reality treatment rooms, which are basically fun and engaging games. After every session, there are full analytics, so both the patient can see their outcomes, the clinician can see the outcomes, and by doing so, allow us to quantify outcomes better than any technology out there. Once the patient is done, they can ship the headset back to us, or they can keep the headset and use it under a subscription model. VR AR devices are unique, and we believe that they will be meaningful and transformational for the healthcare arena because of two major elements that this technology brings to the table. Once you're putting a VR headset on, you are stepping into a virtual reality environment, and you are part of the computer-generated environment. And that allows us to manipulate the virtual reality environment and understand better how the patient reacts and how they are progressing over time, where we have clean and actionable data. So that's one part of why VR and AR will be transformational for the healthcare arena. But the second part is that I think people understand today that a lot of the health issues that we are experiencing are not just biological. A lot of them are also related to how we perceive things. And virtual reality allows us to hijack the brain to treat the body. And by doing so, we can harness the power of the technology to actually teach our brain and our mind how to cope with those conditions or injuries. Because of that, we are seeing better outcomes than a brick and mortar clinic across the board, especially in pain management, but also on the stress and anxiety side. And we believe that at some point, virtual reality and augmented reality will replace drugs. We're conducting multiple clinical trials, 14 actually, and we are seeing amazing results. The second part, which I think makes us unique, is that instead of now driving to a brick and mortar clinic, you can just reach out and grab the headset. And because of that, we are seeing patients using our headset sometimes 3 hours a week. And that allows the patient to be more engaged with their own treatment plan, make sure that they are on the right path for recovery. And for some diseases and injuries, that could be very, very impactful and help people maintain their lifestyle without going to the hospital and helping them and basically helping them maintain their lifestyle even if they have some kind of a degenerative disease. The company is now over 70 people operating in 3 different countries. We have virtual clinics, fully operational virtual clinics in Massachusetts, in Michigan, in Australia, and in Israel. And we, as we speak, scaling to roll out those virtual clinics across the US, and we are hoping that by next year we will be live in all the big states across the US. Thanks for having me. It's a pleasure to be one of the winners in the LG NOVA program, and we are looking forward to partner with LG and take this new type of technology with the help of LG across the US and across the world. Thank you very much.